There's four different types of major heart disease. One of the more common ones, of course, is coronary artery disease. It's caused by inflammation. I actually wrote a paper on that in 1971. It was published in an international pathology journal, Acta Pathology, out of Denmark, translated into 6 languages, based on 20,000 autopsies, 20 million chemistries, and 20 million slides with that many different stains and everything. And of course, all my buddies said, well, you got to be a sniffing clue. Everybody knows it's cholesterol. Well, I said it was inflammation. It's caused a swelling of the lining or intima of the arteries, which then caused scar tissue to come, and it's the basic cause of plugging, because it was the vegetarians who had the worst plugged arteries, not the meat eaters, just the opposite of what everybody was saying. Well, and then there is, of course, blood clots, coronary thrombosis, pulmonary embolism, stroke, thrombotic stroke, you get a blood clot in the brain. This is caused by a deficiency of omega-3s, of essential fatty acids, or ratio problems between omega-3s, 6s, and 9s. And of course, if you have plugged or partially plugged arteries in the brain or the heart or the lungs or the kidneys, and then you have a deficiency of the omega-3 essential fatty acids, you have a high propensity for thrombotic stroke and thrombotic coronary artery disease, which is going to kill you. A serious heart attack or a stroke or a pulmonary embolism. And then there is what we call a hypertrophic cardiomyopathy heart disease, which causes sudden death, particularly in athletes, sudden infant death syndrome, certainly not how the baby sleeps on his tummy or on his back. It's only babies that are fed formula get sudden infant death syndrome. It's not breastfed babies, and that's because they're missing this one mineral in it called selenium. You supplement babies with selenium, they don't get sudden infant death syndrome. You supplement athletes with all 90 essential nutrients, throw in extra selenium into the pile, and give them the rebound sports drink, they don't get hypertrophic cardiomyopathy heart attack, sudden death. And then the most common cause of heart death in industrialized nations is congestive heart failure. It's a deficiency of a single vitamin. This was discovered in the 1700s by a Japanese naval surgeon. That's right, congestive heart failure is something that can be reversed in anywhere from a week to 2 weeks, usually about 7 to 10 days. You don't have congestive heart failure anymore by getting rid of the offending problems, which include sugar in this case, because increased sugar actually causes the deficiency of this one vitamin to get worse. A deficiency of this one vitamin gets worse when you take in lots of sugar. And what I like to do for people with heart disease are at risk for heart disease and give them all 90 essential nutrients, so something like the Healthy Start Pack appropriate for the body weight. Then I give them the Ultimate Daily Tablets, which are designed to support and promote healthy blood flow through blocked arteries. I'll throw in the HGH, which has an enormous amount of an amino acid in there, which actually causes the arteries to produce a substance called nitrous oxide, which actually opens up the arteries, dilates the arteries to get more blood flow through them. And this could be for the brain and the heart and the kidneys and so on. And that's per 100 pounds of body weight, 3 twice a day of those Ultimate Daily Tablets. And then the Ultimate Selenium, 3 of those twice a day per 100 pounds of body weight. This is for the cardiomyopathy heart disease. And then 3 of the De-Stress capsules twice a day per 100 pounds of body weight for the congestive heart failure. And this covers all ranges. And I've actually had people, pastors in Southside Chicago, who've been on the heart transplant list for 3 years, been treated for heart disease for 12 years, and in 1 week's time, their cardiologist, their transplant cardiologist, and their cardiologist actually took them off of 27 prescription drugs and declared them cured of their heart disease after 10, 12 years, whatever it was. Got them off of 27 prescription. I didn't do that. I just gave them the supplement program, and their doctors took them off the 27 prescription drugs and took them off the heart transplant list and declared them to be cured. And so what does this tell you? It tells you the first thing you need to do is make sure you don't get into trouble with your heart. You only have one of them, right? And, of course, you're going to get a lot of spin-off from that because all the other tissues in the body require all the same nutrients. And so I like people to get the 90 essential nutrients before they get sick. Don't wait until you're sick. You're terminally have 3 seconds to live and then ask me if vitamins and minerals can help. What you want to do is take the 90 essential nutrients, 1 Healthy Start Pack per 100 pounds of body weight per month. Give your body what it needs, just sort of like putting oil in your car before the engine burns up. You don't put oil in your car after the engine burns up. You put oil in your car before the engine burns up. So when you die at 120, you should have 2 pieces of paper in your health chart. One is a birth certificate, the other was a death certificate. If you have a 2-inch thick health record, you're going to see 3 specialists you're on 18 to 20 different prescription drugs, and you get a new disease every 2 or 3 years, somebody needs to go to jail. And it ain't you. It's not the patient. It's the doctors which are milking your insurance policy, whether it's government or private, like an ATM machine. They are plucking your strings. And so you need to get on the 90 Essential Nutrients, get a hold of one of our books, and better yet, get the trilogy of books, Let's Play Herbal Doctor, and Passport Aromatherapy, and learn how to reverse and actually reduce your risk of over 900 different diseases to just about zero. This includes birth defects. Every one of the birth defects you can name, and 10 times that many you can't. We're talking chronic degenerative diseases, heart disease, dementia, macular degeneration, lupus, fibromyalgia, arthritis, osteoporosis, osteopenia, bone-to-bone arthritis. We're talking about kidney failure. We're talking about diabetes, obesity. All of these diseases, and many of them are physician-caused disease like Alzheimer's disease, erectile dysfunction, and sleep apnea. There's no such disease as sleep apnea. Sleep apnea is a normal behavior. Here's a case where doctors turn a normal behavior that your sleeping partner complains about, and they turn it into a disease. The mafia would go to jail for such stuff. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Now, Doc, you write a lot of books. Now, do you ever use one of these pen names, to write a book under, a different name?
No.
Okay, so you haven't done that. So then this
It's always under my own name.
Okay, good. I started wondering because I saw this Fox News story that was headlined "The Great Cholesterol Myth," and there's actually a Dr. Johnny Bowden who has a book out by that same title, and he was being interviewed by Fox's senior medical guy, Manny Alvarez, and they say heart disease is the #1 killer in the U.S. What often makes the disease so deadly is high cholesterol. However, one doctor says that's all a myth. And that's this Dr. Bowden. He says that this lowering your heart disease may not necessarily even prevent heart disease. As he says that it's not even really a good predictor of heart disease. Said half the people admitted to hospitals with cardiovascular disease have normal cholesterol rates, and there's half the people that are with elevated cholesterol have normal hearts. And he goes on to say he doesn't necessarily think that cholesterol plays no role whatsoever in the development of heart disease, but what is actually done has taken our attention away from other important factors in cardiovascular problems such as inflammation, oxidative damage, stress, and sugar in the diet. So I think that requires... Because you've been talking about this for, 40, 50 years or more, how cholesterol
44 years
isn't that
now,
big a deal. And he goes on to say that part of this problem is, he says there's cholesterol used to be just one number, the two main types, HDL and LDL. He says that there are actually 5 different kinds of each. He says they behave quite differently in the body. He says there's an LDL-A and an LDL-B. He said the A is like a big cotton ball, doesn't do any damage, doesn't get caught in your arteries, but the LDL-B is the bad guy. And he says, why so much focus on cholesterol? He said the statins have become a problem as well, something else you've been talking about, and said medication is often overprescribed. And they go on to say that they really show no benefit. They say especially in women shouldn't take statins at all because there is no evidence that a woman has ever been saved from a heart attack by using statins. And even scarier is that now they're prescribing them to kids, and goes into how, their cholesterol is needed for brain development and all in kids. So this is really just a bad way to go.
Yeah, you're exactly right. Of course, statin drugs have created Alzheimer's disease. Alzheimer's disease is a physician-caused disease because 75% of a human's brain weight is the white matter, the myelin, which is the insulation material in the brain. When it goes away, the nerve fibers tangle up. You get Alzheimer's disease. Well, Alzheimer's disease is a physician-caused disease. They put people on a cholesterol-restricted diet, egg beaters, chicken without skin, oils instead of butter and cream and lard. And what do we got out of it? Alzheimer's disease. Didn't exist 42 years ago. Now it's the #4 killer of adults over the age of 64. Erectile dysfunction. You can't make testosterone. 95% of testosterone is cholesterol. You can't make testosterone. You're on a cholesterol-lowering drug and cholesterol-restricted diet. And so low testosterone, erectile dysfunction is a physician-caused disease. And then, of course, another one that has to do with cholesterol is menopause. Ladies, your great-grandmother, depending on how old you are, went through menopause at age 70 in 3 seconds. She was still cycling and having babies into her 60s. Well, why now do women spend 30 years wallowing through menopause and prescription hormones and everything? Because estrogen, progesterone are 95% by weight cholesterol. You want a cholesterol-restricted diet? You're eating egg beaters instead of eggs. You're eating margarine instead of butter. You're using oils that cook instead of lard. Boneless, skinless chicken breast, tofu, and beans instead of meat. You got menopausal problems. You go through 5 husbands because nobody can get along here. Wow. Eat 6 eggs a day. Take the 90 essential nutrients and flush the doctor and the statin drugs down the toilet. Do not give them to kids. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Wisconsin. And Tabitha, you're on with Dr. Wallach.
Hello, Tabitha, you're on the air.
Hi, Dr. Wallach. I had a question. I spoke to you, I think, last week. You were mentioning about, I had mentioned about IBS and gray hair. And you had asked about my weight, and you were talking about about ASAP. And I was wondering with IBS, how would I be able to absorb that ASAP, and what would I need to do in order to alleviate this gray and white hair that I still have in my head?
Okay, I'm going to repeat what I said then because it's still true now what I said then. Okay? You need to take the 90 essential nutrients appropriate for your body weight. What do you weigh?
256.
205?
256.
Oh, 256. Okay. Ideally, you would take 3 Healthy Start packs per month. That would be 1 ounce of the Osteo FX Plus at breakfast, lunch, and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast, lunch, and dinner, 3 of the EFA Pluses at breakfast, lunch, and dinner. All that will be accomplished by the 3 Healthy Start packs per month. Then that's the basic platform of just the nutrients you need just to live. Okay, that everybody needs this, regardless if you're a 20-pound person, a 50-pound person, a 100-pound person, 200-pound person, or 300-pound person. It doesn't matter. Everybody needs this appropriate for body weight, the 90 essential nutrients. Then, because you have a history of IBS, irritable bowel syndrome, additionally, for you to get maximum benefit of that basic platform of the 90 essential nutrients, you need to give up all wheat, barley, rye, and oats. No wheat, barley, rye, and oats. I'd urge you. I'd implore you to get a hold of that CD called Serial Killers and listen to that 10 times. Get a hold of the book Hell's Kitchen, read that, and listen to that CD, Hell's Kitchen, and you'll know more about weight loss and metabolism than all doctors out there except me. And so this is imperative that you understand what's going on here, not just blindly take stuff. Then I would also have you take 3 of the Sweeties 3 times a day. That's 3 at breakfast, 3 at lunch, 3 at dinner. That's 9 Sweeties a day. That's 3 bottles a month of the Sweeties. That's to support and promote healthy metabolism of carbohydrates, fats, and sugars at the cellular level. It's going to support and promote healthy blood sugar levels. I would also have you, and I'm assuming is at 256 you're going to have some joint problems. I would just take the glucogel, take 20 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner, 5 at bedtime. That'll be 3 of the large 240-count bottles of glucogel. And then I could throw in a lot more stuff, but let's not. Let's just throw in the ASAP. I want you to take, excuse me, I want you to take 2 droppers full of the ASAP under your tongue, 30 minutes before each meal. That's going to require 2 bottles a month of the ASAP, and you're going to lose anywhere from a half a pound to 2 pounds a day. Now, it's going to start out slow because it's going to take you 3 to 6 months to get maximum repair of your intestines so you can absorb maximally. Right now, you may only be able to absorb 20%, but 20% is better than nothing. We got to get going here, girl. We'll be back after these messages.
Let's head to San Antonio, Texas, and Jimmy, you're on with Dr. Wallach.
Hello, Jimmy. You're on the air.
Good day, Dr. Wallach. I'm calling on behalf of my mother. She's 25. She's a height of 5'5", weight 235.
235?
235, correct.
Mm-hmm.
And the illnesses I have here is just been diagnosed maybe about 2 months ago. 2 centimeter liver tumors. She has cirrhosis of the liver. And right now the doctors are suggesting a alternative treatment of radiofrequency ablation procedure to remove the
Okay, now these tumors, are they benign fatty tumors, which are actually quite common in the liver, or are they cancer?
They haven't classified it as cancer yet. They haven't, I guess, diagnosed it as cancer.
Yeah, it's not unusual when somebody's overweight that they're going to have kind of fatty tumors in the liver. It kind of goes with the territory. And so, of course, liver cirrhosis is actually due to a nutritional deficiency of the liver. It could be multiple nutritional deficiencies of the liver, can result in liver cirrhosis. 95% of the people who get liver cirrhosis don't even drink alcohol. Although doctors, that's the first thing they're going to ask you is, where are you getting your alcohol? That's only 5% of the cases. 95% of people get liver cirrhosis because of nutritional deficiencies. Then, let's see, does your mom have anything like diabetes or high blood pressure?
Yes, I have a list here. I have Parkinson's and arthritis, chronic back pain in joints and legs, the fibromyalgia. She's been a diabetic for over 20 years, type 2 diabetic, and high blood pressure and high cholesterol as well.
Okay, well, here we go. Got your pen out.
Yep.
We need to stop the ongoing damage. So the first thing that needs to happen is she needs to get rid of all the bad stuff. Obviously, no sugar. She's a diabetic. No sugar in any way, shape, or form. That means no juices, no fruit, no agave syrup, maple syrup, corn syrup, no alcohol, no honey, no molasses. Absolutely no fried foods in any kind. I mean, no fried foods, no exceptions. I don't care if it's extra virgin olive oil or coconut oil, and stir-frying organic vegetables, can't have it. Then no oils, no margarines, mayonnaise, salad dressings, cooking oils. If she eats canned fish, they got to be packed in water, mustard, tomato sauce, not oils. I'd also have her take, let's see here, I said no fried foods, no processed meats. Oh, she needs to get rid of all gluten, no wheat, barley, rye, or oats. No wheat, barley, rye, or oats. I want her on vegetables and eggs, just vegetables and eggs. Then the supplement program is going to cover all these problems. And, of course, if it turns out that these things are cancerous, which is a very low probability, then I need to know that. But in the meantime, we're going to assume for the moment, since the doctors weren't too excited, whether it was on CAT scan, ultrasound, or however they diagnosed these bumps in her liver, that they're benign. Otherwise, they would have been excited to get her on the chemotherapy immediately. So let's see how that goes. But anyway, right now, let's give her 235. I'd give her 2 Healthy Start packs per month. That's 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and I'd also have her, well, we got about 14 other things to do here, so hang on. We'll be back. We'll give her the rest of this information after these messages. Okay, Doug, let's go right back to Texas and Jimmy. Okay, again, 2 Healthy Start packs per month, 3 of the selenium 3 times a day, 3 of the de-stress capsules 3 times a day, 3 of the Ultimate Daily tablets 3 times a day, 3 of the Sweet Ease 3 times a day. Be sure your mom takes her fasting blood sugar every morning before she medicates herself, because she will have her blood sugar dropping very rapidly, so we don't want her to get in trouble with too low blood sugar. And then for the fibromyalgia and the arthritis and the back problems and all that kind of stuff, I want her to have the glucogel. I want her to have 15 glucogel capsules a day. 5 at breakfast, 5 at lunch, 5 at dinner. That's 2 of the large 240-count bottles per month. And then call me every couple of weeks. You're going to be amazed. With these nutrients, this can support and promote a healthy recovery of the liver, support and promote healthy maintenance and repair of the liver, high blood pressure, diabetes. All of these things you're describing are nutritional deficiency diseases. And at 5'5", I'd like to see her weigh like 140, so maybe she needs to lose 100 pounds. But let's get her going here. Let's get everything stabilized. Let's get her off her blood pressure medication. Let's get her off of her diabetes medication, and then we'll talk about seriously reducing her weight. This will begin. She'll begin to lose some weight, maybe even a quarter of a pound a day. But we're going to get her down faster, but she's got to first wean off of her Sweeties, excuse me, not her Sweeties, but her diabetes medication. She's got to wean off of her high blood pressure medication. Then we'll get her on the serious weight loss program. Okay, Doug, let's go to callers.
Let's head to Nebraska. And Diane, you're on with Dr. Wallach.
Hello, Diane, you're on the air.
Great. Thank you, Dr. Wallach.
Mm-hmm.
I listened to you talk about avoiding cooking oils and such. My husband, he don't believe that. He is facing...
Okay, get a good insurance policy and start looking for a new husband.
Okay. He's facing surgery for diverticulitis and a fistula. Is there any possibility that the fact that he does not want to avoid these oils could have something to do with this condition? And if it does, can you explain a little bit about how oils and trans fats and what have you affect the body?
Well, sure. Well, first of all, when you have diverticulitis, diverticulosis, irritable bowel syndrome, inflammatory bowel disease, colitis, ulcerative colitis, celiac disease, these are all a gluten intolerance. The first thing he has to do is get off of gluten. If you live in the same house with them, you got to get off of gluten. If you have any dogs and cats in the house, they got to be on either a gluten-free dry cat food and dog food that says in big bold letters on the bag, gluten-free, or they got to eat canned dog and cat food. You cannot be eating gluten, can't be in the same house. He cannot go to Whole Foods. You cannot go to Whole Foods because all that dust from those bulk grain bins get all over the place. You wash your clothes with his, and you got a mess. So this is very, very serious stuff. I'd have him listen to that CD called Serial Killers. And, of course, he needs to supplement with the 90 essential nutrients appropriate for his body weight, which includes the omega-3s and so on. Well, why does that work? Well, if you're eating fried foods particularly, you get trans fatty acids, heterocyclic amines, and acrylamides, which cause inflammation of the tissues. And when you can't absorb nutrients, you certainly can absorb the free radicals. That's the trouble. When you can't absorb nutrients to defend yourself, and then you're taking all these things that produce free radicals, you get a double hit because you can't protect yourself, but you can absorb the free radicals. And so you're going to get even more damage than if you could absorb your nutrients. You are not what you eat, as it used to be said. You are what you absorb, and certainly gluten intolerance will reflect itself in how people actually absorb nutrients. It takes an adult about 3 to 6 months to completely repair their intestines. They should start seeing improvement in absorption, reduction in symptoms of nutritional deficiency diseases within 2 weeks of starting a gluten-free diet. But it's got to be drop-dead gluten-free. That means no deli slices, no sandwich meats, no fried foods, no processed meats with nitrates and nitrites, no oils, and certainly no gluten, no wheat, barley, rye, and oats. If he's a beer drinker, he can have Red Bridge from Anheuser-Busch. It's gluten-free, certified gluten-free by the FDA, which I don't particularly like them, but they're pretty persnickety when it comes to that kind of stuff. And then also there's a lot of rice beers in the Oriental food stores. Okay, Doug, let's go to callers.
Let's head to Monterey, California. And Ed, you're on with Dr. Wallach.
Ed, you're on the air.
Yes, sir. Hi. My age is 62. I'm 185, 5'11". I think it's the problem is type 2 diabetes from listening to you. But let me throw a few symptoms at you. When I was in my 40s, I had something called plantar fasciitis. Kind of went away. Now I have numb toes, numb feet. My calves are kind of numb up about halfway.
Mm-hmm. Do you have a back problem?
Oh, I used to have major back problems.
You still have a back problem. Okay, go ahead.
Okay. Loss of hair on my legs, about halfway up the calves, seem to be basically in the front and the back. Stiff joints, stiff feet, calves extremely cold just about all the time. Leg muscle weakness, get cramps at night, difficult to walk upstairs.
Yeah. Have you been to doctors for all this stuff?
No, I'm kind of, after listening to you, I've been afraid to. I've tried some of your products, but I don't think that I've tried them.
Now, why do you think, none of this says you have diabetes. All this says you have peripheral neuropathies caused by degenerative disc disease in the back, and you have arthritis. Okay, so why are you thinking you have diabetes?
Well, I wouldn't, that's why I'm calling you.
Okay, well, here's how you do it. It is very simple. What you do in the morning, before you eat, you go ahead and you get one of these little bottles of these test strips from the drugstore without a prescription. They're your blood sugar test strips. You don't even need a machine. You can use one of these little bottles. They usually have a spectrum of colors on there, and you just match the color that your blood turns that test strip, and you match the box, and it'll tell you approximately what your blood sugar level is. Okay? Anything above 100 is prediabetes. Anything above 120 is full-blown prediabetes, and anything above 140 is full-blown diabetes. And so there's no rules here, Ed, that says you can't have 14 diseases at the same time. It's very common that people who have type 2 diabetes also have prostate problems, degenerative disc disease, You can get respiratory problems, macular degeneration, fibromyalgia, all this stuff. And they're all nutritional deficiency diseases. They run together. Nobody except a laboratory rat ever gets a single nutritional deficiency, which is set up by how the diet is concocted. People out there, if you're not absorbing very well, you're going to be deficient in many nutrients. If you are absorbing well and you live in a place that doesn't have many nutrients, particularly minerals in the soil, and you're eating entirely out of the local farmer's market because you want to save the earth, well, then guess what? You are going to be deficient in those nutrients. And so I'd urge you to get a hold of the Healthy Bone and Joint Pack. Take the Sweeties, take 3 of those twice a day, and then find out, test your own blood sugar. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. And, Doug, let's go to callers.
Let's head to South Dakota. And, Al, you're on with Dr. Wallach.
Well, Al, you're on the air.
Yes, Dr. Wallach. I wanted to know what your treatment is for ear mite treatment for cat and dogs.
Okay, ear mites are very simple. What I would do is get a hold of the peppermint oil from Youngevity's Aromatherapy Ancient Legacy Division, Ancient Legacy member of our family of companies. Excuse me. And I would take some mineral oil or corn oil or any kind of oil, cooking oil, grapeseed oil kind of thing, and I would put 1 drop of the peppermint oil in the other oil, the diluting oil, and put a couple of drops of that mix into the cat's ears or the dog's ears, and do that 4 times a day. And the oil will actually suffocate the mites. And also, if there's a little excess wax in there, it'll dissolve the wax too. And just to put it in 2, 3, 4 times a day, a couple of drops of that mix, and 1 or 2 drops of the peppermint oil in, say, a teaspoon of grapefruit seed oil or corn oil or whatever it is you want to put in there, and you'll find that it will suffocate those mites. That's pretty simple stuff. Okay, don't forget to give the dog and cat, keep their immune system up. Give them our Arthrodex. It's 1 scoop per 25 pounds of body weight. So if you have a 10-pound cat, I just give them a half a scoop of the Arthrodex. And, of course, in dogs, it's the same way. If you have a little 10-pound dog, it's a half a scoop. You get up to 18, 20 pounds, I'd give it a full scoop, and so on. Okay, Doug, we got time to squish in another one?
Yes, we sure do. Let's head to Arkansas. And, Renee, you're on with Dr. Wallach.
Hello, Renee. You're on the air.
Thank you. Thank you for taking my call. I have 2 questions, please. I'm on the Healthy Starter Pack Monthly, the ASAP, and Selenium. And I have 2 things. One, with my thyroid, they have me on Synthroid at 100 milligrams a day, and I was wanting to know if I needed to still do that. And then they sent me to be tested for sleep apnea. And what
okay, sleep apnea is a normal behavior. It's not a disease. Fire the doctors who want to test you for sleep apnea. They're turning a normal behavior into a disease. Everybody who goes to a sleep clinic is found to have sleep apnea because it's a normal disease. I'm going to invent a disease here called Blinky, Renee. Anybody who has Blinky, I'm going to put on the anti-blink drug that I'm going to invent, and I'm going to have a laboratory which diagnoses Blinky. Anybody that comes in there that blinks has a disease called Blinky. It's just like everybody who has sleep apnea, who goes to the sleep lab, has a disease because everybody who goes there is going to be found to have sleep apnea because it's a normal behavior. Watch a baby sleep. Watch a dog sleep. Watch a snake sleep. Watch an elephant sleep. Watch a zebra sleep. They all have sleep apnea. It's a normal behavior. I just get crazy when doctors turn a normal behavior into a disease and the people buy it. Do not do that. Fire the doctor who comes up with that. And anybody else, if the mafia were to do stuff like that, they go to jail for racketeering. If a doctor does it, they just get paid by insurance. Okay, so we got to stop it. Nobody dies of sleep apnea. If you die because you're snoring, it's because your sleep partner killed you.
Okay.
Okay, so nobody dies of snoring. That's why Grandma and Grandpa slept in separate bedrooms for 25 years.
Right.
Because one of them snored.
They put me on trazodone, 100 milligrams at night.
What, for sleep apnea?
Well, they told me I didn't have it. I just was not going into a REM sleep every night.
Okay, stop. Throw the darn drug away. Take your 90 cents. What do you weigh?
150.
Okay. Take 2 Healthy Start packs per month. Stay away from fried foods, processed meats. Don't drink caffeine after midnight. Have a couple of scrambled eggs before you go to bed. Don't eat ice cream. Don't have pie or cake. Don't eat sugar before you go to bed. Have a couple of scrambled eggs or poached eggs or a steak before you go to bed. And then you'll do well. Throw away the drugs. Fire the doctor. Okay, thank you, everybody. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.